Hi, my name is Reagan Archibald. I'm the founder of East West Health, and I'm so excited that you're watching this webinar. And I am excited because stem cell therapy is something that's transformed my life, and I've seen it transform the lives of thousands of patients, just like you. I've seen people who've come to me, and I often find that they're struggling with some type of pain condition. Maybe it's osteoarthritis in the knee. They've been told you've got bone on bone. The only answer is going to be surgery or a total knee replacement. And I'm here to tell you that there's another option in healthcare. There's a whole brand new opportunity to transform your life without drugs and without surgery. I often have people who reach out to me and they say, Reagan, I've got degenerative discs in my neck, I've got this hip pain, I've got sciatica, I can't sleep at night, I can't do the work that I used to, I can't go hiking with my kids, I can't play with my grandkids. And so we give them answers that can radically transform their health, which will transform your life. Because here's what I believe more than anything. I believe that if we can give your body the right direction and influence it in the right way, your body can recover from some of the most devastating diseases, no matter how long you've had pain. Some of my patients, like one of our NFL quarterbacks came in this morning. He's one of the healthiest, fittest guys you'll ever meet, but yet he's got needs. We treated his neck, we treated his shoulder. We've got other patients who are like my patient Bonnie. She's in her 90s and she wants to have health in her knees. And so we treated her knees, and now Bonnie's able to walk without her walker. She's able to get around her house, and she's got her health independence and health freedom. So what I found is there's three simple ways that we look at it. When you're looking at a stem cell clinic, the things that differentiate them more than anything are making sure you've got the right stem cell product. And so in this webinar, what I'm going to be talking about is where you can source your stem cells from. The second thing you want to make sure is that you work with a clinic who's focusing on everything in the body A to Z. And the third thing we're going to focus on today is what types of aftercare treatments are going to be necessary for you to get the results you're looking for. Because those three things can make all the difference in the world in your outcomes. I remember snowboarding. I was going 40 miles per hour down the mountain. I had a skier cut right in front of me. So in that moment, I had two choices. I could either hit the skier or hit a tree. And I love trees, so I took out the skier, and when I got up, I knew my shoulder was wrecked. After about 6 months of, a lot of pain, not much as far as healing goes. We were trying acupuncture, PRP, we did everything we could think of, but nothing seemed to give me the relief that I needed in my shoulder. Finally, I went to a surgeon because I said, I'm gonna need surgery, I know it. My kids started telling me, Dad, you're getting grumpy, you seem to be disengaged at night, and my work was suffering because I was in so much pain all the time. So I went to the surgeon and she said, yeah, you're gonna need surgery. It's going to be an invasive procedure, but we can do it. And I looked at that and I said, man, not only was the expense way more than I wanted to pay for a surgery, but the cost that would put the burden on my patients because I wouldn't be able to treat them, the burden was on my family, the burden was on my friends and all the commitments I'd made. So I looked at the surgical option and I said, there's gotta be another way. And so I asked her, I said, what are my other options? And she said, well, have you looked into stem cell therapy? And I said, I'd love to do that. What do you know about it? And then what the doctor told me is, I don't know anything about it. There's not enough research. You're gonna have to go find it out on your own. And so as I started doing the research, I found there's actually a lot of research, and some of it's from the United States, some of it's outside of the United States. And I ended up working with doctors out of Texas. We injected my shoulder, and finally within 3 days, I was able to sleep through the night. First time I'd been able to do that in months. By the 3-month mark, my shoulder was 80% better. By the 6-month mark, my shoulder was just as strong as it was before the accident. And now I can happily say that 7 years later, I've got great range of motion. My shoulder's just as strong as it's ever been. And I'm incredibly grateful for what I was able to have happen in my own health transformation. And I want to do the same thing for you. So if you look at that and you say, well, okay, Reagan, well, I want to get my pain fixed. Let's say you have a rotator cuff tear as well. How does this work? Well, if we just break down and we jump into the science a little bit, if you look at what a stem cell is a master cell in your body. And this master cell can become any one of the thousands of cells that you've got. We've got over 220 different types of cells, and then you've got trillions of cells in your body. And if you have enough healthy stem cells in your body can literally heal from anything. And so all we're doing is we're influencing the stem cells in your own body by putting this perinatal tissue or by putting stem cells in to motivate the healing properties in whatever has been damaged in your body. So if you look at your body, as we age, we're losing about 300 million stem cells every single minute. So every minute you're sitting here with me, unfortunately you're losing all these stem cells. And so what replaces those cells are stem cells. And so you have stem cells for your eyes, you have stem cells for your hips, your cartilage, your bones. And so if you have enough of these young, vibrant stem cells, your body can heal from almost anything. But as we age, our stem cell populations decline. Not only do our own stem cell populations decline, but the stem cells that we have left are not as active. And so that's one of the reasons I chose to use stem cells from an umbilical cord and placental tissue. And so in doing that, I was able to get the regenerative properties in a safe, natural way that helped me recover from my shoulder injury. And since then, I've treated my knee for a meniscal injury, I've done my neck, my spine, and we've seen over 4,000 procedures be performed here at East West Health very successfully. And so I don't know what your pain condition is. Many people come to us because they've got, like I mentioned before, knee issues, bone on bone, you want to walk again, you want to play with your grandkids, you want to travel more. Some patients come to us who have more further progressed things, like my patient Patty, who is a medical doctor who had been diagnosed with MS 5 years before I met her. And what Patty said is, she said, wow, I'm starting to notice the effects of my MS. I've got brain fog that's very severe. She was struggling just walking on her treadmill. She wanted to continue her practice, but her MS symptoms were getting in the way of her actually living the life that she dreamed of. And she wanted to serve people. She couldn't serve because her health was so diminished. And so what we found with Patty is, after her treatment, what Patty reported is not only are her hands working better, but her brain is turned on. And now she went from just being able to walk, which was a challenge because her balance was compromised, but now she can run. She can jog a little bit, which is very exciting. So we're seeing some phenomenal turnarounds. We have other patients who come to us because maybe they have depression or anxiety and they need some brain rejuvenation. Our brain rejuvenation process can help them. We have patients who have addictions. We have patients who have all kinds of damage from either a stroke or some type of internal disease, some autoimmunity like Hashimoto's or diabetes. So there's lots of ways that we can help influence the healing in your body. Now, of course, none of this is a panacea. What I'm saying, this is not a drug. And so this has not undergone the same type of pathway that your typical drugs would go as far as science goes, but there's been lots of science that's shown the safety of this procedure. There's also many research papers that have shown the efficacy of it, and that's just growing in time. So what I hope to accomplish with you as we take you through your examination and as we consult you is that you look at your health goals and you say, okay, what thing am I looking to get out of this? What are my goals? What do I want to accomplish? You know, if you're looking for a silver bullet, this is not it. But if you're actually looking for something that can transform your life and your health and help move you in the right direction, this might be the solution that you're looking for. The very thing that could get you from a place of being in chronic pain and disease to a place where you can be off your medication and prevent surgery. So we look forward to meeting with you and can't wait to see you in the clinic. The best way to get in touch with us is look on the screen. We've got all our contact information there, and really can't wait to help you find your health independence, because what I believe is that your body can heal if you give it the right environment. What I believe more than anything is there are solutions out there for the toughest conditions. No matter what, no matter how many doctors have told you there's no hope, there's nothing that can be done, there is help out there. And so what I believe more than anything is you deserve to live a healthy, free, fully expressive life where you can get back to doing the things you love.